Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. As of June the 20th, there were over 19,000 confirmed cases of COVID-19 in Nigeria. More than 6,500 people had recovered, and there were 487 deaths. Those considered to be at high risk for COVID-19 are the elderly and those with underlying conditions such as sickle cell disorder. For sickle cell disorder, nowhere is this more applicable than in Nigeria, which has the highest number of those with it all over the world, and where 2 out of every 100 children is born with the condition. As the number of cases of COVID-19 goes up daily in the country, special attention must be paid to those living with sickle cell disorder. My guest from the Sickle Cell Foundation is also a pediatrician at the Lagos University Teaching Hospital, both located in Indiaraba. Dr. Olayonju Mokwenye, you're welcome to the show.
Well, thank you for having me.
What characteristics of sickle cell disorder make people living with it so vulnerable to COVID-19?
Okay, sickle cell disorder is an inherited disorder of the blood that affects the red blood cells specifically. And it's characterized by abnormal hemoglobin. It's a multi-systemic disease.
It affects all organs of the body.
All the systems of the body, including the immune system. The immune system is central in fighting COVID-19 infection.
Okay.
The spleen, which is a central organ in the immune system, is also affected. And it is known that patients living with children and adults living with sickle cell disease have impaired splenic function.
Okay.
In addition to this, they also have impaired lymphocyte function. The lymphocytes are the soldiers in the blood that helps to fight infection. They also have impaired production of opsonins. Opsonins are like chemicals that flag foreign microorganisms for destruction. And in patients with sickle cell disease, they have impaired production of opsonins.
So there will be some microorganisms in the body that should be destroyed but can't be destroyed.
Yes, so they can't undo some organisms.
What does the spleen do? What's the job of the spleen?
Okay, the spleen helps in production and maturation of blood cells like lymphocytes. It's also
so everything is just connected to the immune system.
Yes, it's connected to the immune system. It also acts as a filter. It helps to engulf microorganisms when they enter the body, and it also helps in the production of blood cells.
Would you say, can you quantify how the COVID-19 pandemic has affected people living with sickle cell disorder in Nigeria?
No doubt, the pandemic has caused a lot of disruptions. And this disruption ranges from access to healthcare facility, because we had lockdown, and this affected the ability to get to the healthcare facility.
But shouldn't that have been different? I mean, for people with special conditions? Wasn't that part of the bargain?
Yes, that was part of the bargain. However, we all know that not everybody in this area has a means of transportation, a personal means of transportation. So it becomes difficult when they want to access the healthcare facility when there's a lockdown. And on getting to the hospital, we were all aware that a lot of doctors got infected.
And true.
This means that the workforce is decreased. And also, a lot of patients who are living with sickle cell disease come to the hospital for blood transfusion.
Yes,
and some
that
other
is a major thing for them, right? But was anybody donating blood? I mean, is anybody donating blood now?
People were still donating, but we had reduced number of donors because of the prevalent panic resulting from the pandemic.
Yes. What extra precautions do people living with sickle cell disorder need to take in this time of COVID-19?
Okay. Most importantly, they have to adhere to the preventive measures as outlined by the Nigerian Center for Disease
So
Control.
major things that everybody else does: wash your hands, wear your mask, social distancing.
In addition to this, they need to avoid precipitants. There are certain things we call precipitants that could increase the incidence of crisis in them.
Okay.
They have to stay hydrated. They have to continue to take their routine medication. Like children less than 5 years, they are supposed to be on penicillin V. They should have their vaccinations. They should take their routine Proguanil to prevent malaria. They should take their Hydroxyurea for those on Hydroxyurea.
Okay, now
And also avoid extreme of temperatures.
Let's look at it practically. COVID-19 came. Nobody was really expecting it to escalate so fast. Well, we were even lucky with that. How do they take their regular medications? Are they regularly supplied, for a long period? Because if somebody has to take, say, folic acid every day, and he runs out of folic acid, what does he do? Is this something he must take?
Okay. So there were a lot of measures that were put in place to surmount these challenges. And this included telemedicine,
Okay.
like delivering healthcare remotely. You can do it with any of your smartphones, So we had phones, you could communicate with them via that. Then a lot of them even know their medications, and they can buy over the counter.
Over the counter.
Yeah.
But do they sell hydroxyurea over the counter?
They actually sell over the counter.
Anything is possible in this country.
They sell over the counter, but they can communicate with their doctors, because there are times that we need to modify the dose as they grow, especially for children.
Okay. So did you at any time, as a body, deliver medications to the sickle cell, those suffering with sickle cell anemia?
Yes, in collaboration with medical social workers.
Okay.
Yes, and some NGOs, Sickle Cell Foundation.
Okay, so what happens if there's a serious problem with somebody who is living with sickle cell disorder, like he has a crisis, a severe chest syndrome or something? What would you ask the person to do? I don't think telemedicine can handle that.
That's an emergency, and such a patient should present to the emergency room and will be attended to.
Now, I'm thinking, with a pandemic like this, wouldn't it be wise to have people who can handle these conditions at the primary healthcare level, somewhere you can quickly get your child to when he's having a problem, and routine things can be done, unless the person, is having a chest syndrome or a heart a stroke or something like that, and then that person can now be taken by that primary healthcare center to wherever they're going to handle more serious cases.
I agree with you, and that is how it's supposed to be. And that takes us to what is called stratification, risk stratification. It is important to be able to define the low-risk patient, the high-risk patient. Patients who have acute chest syndrome do not have anything doing in a primary health center, because they can even need ICU care if it gets worse. So patients with mild bone pain crisis can be managed in primary healthcare setting. But when you're talking about patients with stroke, because they will need exchange blood transfusion.
Yes.
Patients with acute chest syndrome, priapism, such patients should be managed in tertiary or secondary healthcare institutions.
These regular medications that they take, folic acid, hydroxyurea, and the malaria prevention medication, do they, I know they have to take them anyway, yes, with or without any other situation, but do they help to keep the person free from COVID-19, sort of as a defense? Do they act as a defense against COVID-19? Your face says not particularly.
Not exactly. Some of this medication, like the penicillin prophylaxis, is meant to prevent against pneumococcal infections.
Okay.
The malaria prophylaxis for malaria.
Okay.
The hydroxyurea the effect of hydroxyurea, or the aim of giving hydroxyurea, is to reduce the incidence, that's the frequency of crisis that they come down with, for better quality of life, and then to reduce the number of blood transfusions
that they have
so
to
it's
take.
not specifically aimed at protecting them from
So what
COVID-19.
is the folic acid for?
Because it's a chronic hemolytic anemia. They keep breaking down their red blood cells. So the body responds by making new red blood cells for them. And in making red blood cells, folic acid is one of the substrates that is needed.
Okay. That makes it important.
Yes.
Okay, so I see what you're saying now. All these interventions are targeted at a particular problem, not really COVID-19.
COVID-19 wasn't there when all these therapies were.
So there's nothing special to give them for COVID-19?
It's just for them to eat healthy, avoid crowded places, maintain physical distancing. If possible, they can work from home.
Okay. Is this what you call shielding? Or does shielding involve something more than that?
Yes, you can say it's shielding, yeah. Yes, I agree.
Okay, so it looks like these people, if they can help it, they shouldn't actually step out of the house.
Yes.
They should just stay indoors.
Because they are actually vulnerable.
Okay.
They can't handle, their immune system is impaired. So they can't handle infections, not only COVID-19.
Let's think about a situation, like many people have been positing, that COVID-19 is here for the long haul, and we might have to actually live with it. How do people who live with sickle cell anemia go back to school? Have we thought that far?
How do they go back to school? Yes. Okay, COVID-19 has come to stay, and preventive measures has to be adhered to at all levels, including school children. And this includes physical distancing, regular washing of hands, respiratory hygiene, use of face mask. And we're believing that in a few months' time, by God's grace, there will be a vaccine to protect all. But before then, online education has kicked off, and most schools have embraced this. And learning has been taking place.
Yes, it has.
Via online platform. And so it has actually come to stay, and online learning too has come to stay.
Okay, let's take a short break. We'll be back very soon. Stay with us while we take this short break and meet us on the other side. Welcome back. We're talking about the relationship between COVID-19 and sickle cell disease disorder or anemia. It goes by all those names. Now, if you want to call with a question, the number to call is 0805-468-3514. It's appearing on your screen right now. You can also tweet at CTV_Mary A for any questions about COVID-19 in relationship with sickle cell disorder. There's a new treatment, new in Nigeria, for sickle cell disorder, which is the bone marrow transplant. Can you explain a bit of that to us?
Okay, so bone marrow transplant is a procedure that entails infusion of stem cells collected from a donor, a matched donor, to a recipient, who is usually a patient with severe forms of sickle cell anemia. And the aim is to reverse the symptomatology, after the procedure,
The person doesn't have crisis anymore,
again,
doesn't
better
have
quality
leg
of
ulcers.
life. And the beauty is that is a permanent cure for sickle cell anemia. It is now available in Lagos at the Sickle Cell Foundation here in Lagos. So for further inquiries,
people should go to the Sickle Cell Foundation. I imagine it will be a lot cheaper than a procedure abroad.
Yes, it is. It is.
Now, here's the question I have. If somebody goes through this procedure of bone marrow transplant, he's not going to have symptoms anymore.
Yes.
But is he still vulnerable to COVID-19 more than the usual person?
I would say yes.
Yes.
Because
let's quickly take this call before you go there. Hello. Emmy, are you there?
I'm okay.
I'm not hearing you so well. Maybe you try again.
I can hear you.
Okay, speak up.
Hello? Yes, I'm okay.
What's your question?
Yeah, the hydroxyurea you talked about.
Is hydroxyurea?
Can you be admitted to any sickle cell patient?
Okay, thank you. He's asking if hydroxyurea can be used for any sort of sickle cell patient, or is it particular for some?
Okay, so there are criteria for prescribing hydroxyurea, and these criteria include history of stroke, or if a patient has transcranial Doppler findings that put the patient at high risk of developing a stroke.
That's the transcranial Doppler is the instrument you use to check for
a scan of the vessels of the brain, the velocity of blood flow in the brain, and it can predict the risk of a patient.
So by scanning those vessels in the brain, you can tell if a person might have a stroke in the future.
Yes.
Okay. So if you have a high risk of that, that's the kind of person you put on hydroxyurea?
Yes. Recurrent acute chest syndrome is another indication. Priapism.
Okay.
Recurrent severe bone pain crisis.
So if people have a mild form, you don't put them on hydroxyurea?
Yes, we don't put them on hydroxyurea.
Is there a reason for that? Because I'm sure
all medications, despite the benefits, they also have side effects. So before putting a patient on a medication, you need to weigh the benefits versus the risk or the adverse effect. The benefits should outweigh the adverse effects.
Okay. So we were talking about the vulnerability of somebody who has gone through a bone marrow transplantation to COVID-19. And you're saying yes, but this person is not SS anymore, and he's not suffering any of the symptoms of a normal sickle cell, somebody who has sickle cell disease. So how is he vulnerable?
They're vulnerable because after the procedure, they are placed on some medications that can suppress their immunity. So through that mechanism, they are at increased risk.
Okay, let's quickly take Adeolu. Hello, Adeolu, are you there?
Yes, I am.
What's your question?
Yes, please. Yes, please. Good afternoon. Please, is it possible for an 60-year-old sickle cell anemia patient to go through the bone marrow transplant?
Is it possible for a sickle cell patient to go through bone marrow transplant?
A 60-year-old.
Oh, okay. That qualifies it. 60 years old and wants to go through a bone marrow transplant. What would you say?
Okay. It can actually go through the procedure. It can go through the procedure, however...
That means things have improved.
However, the chances of it taking cannot be comparable to someone doing it at a younger age.
But has anybody that old actually done such a procedure?
Yes, I think so.
Perhaps not in this country.
Not in this country, but the risk of graft versus host disease is higher.
Okay.
So the procedure might not really be successful.
But
that
is there
age.
a way of predicting how successful the procedure might be before going into it?
There are already prognostic factors that are well laid out. The younger the age, the better the prognosis. Then at that age, there might be comorbidities in the patient that might affect the success of the procedure.
Okay.
Yeah.
Now, from what you're saying, it just seems as if the person living with sickle cell disorder is as vulnerable to COVID-19 as he is to a cold, a flu, pneumonia.
Yeah.
So people who have been living with that disease shouldn't have any trouble following instructions about shielding and stay. Well, they were not staying at home quite this much before. So it is a bit different, isn't it?
Yes.
Are there any special risks for carriers, people with just one S gene?
Okay, patients with children and adults living with sickle cell traits are like every other human beings. They are asymptomatic. They don't
Okay.
have any features of sickle cell disease. Though rarely, very rarely, they can have some features, but it's not common. They are usually majorly asymptomatic. They are just like every other
normal person.
Every other normal person.
All right. Thank you so much, Dr.
Thank you for
Mokwekwe,
having
coming
me.
to the show. You can call any of these numbers if you or people you know have a fever or other symptoms of COVID-19. This is toll-free and it's NCDC, but if you live in Lagos, you can call any of these numbers. Feel free at any time to go to channelstv.com/podcasts to enjoy an audio version of the program if you missed it, are commuting, or just want to listen all over again. It's been wonderful having you, and thanks for your calls, Femi and Adiolu. Have a wonderful day, everybody. I am Mary Alale Yusuf.